Hey guys, Ken here with bariatricfooddirect.com, and today's webinar is about post-surgery hair loss. It happens to just about everyone, so we're going to look at some of the causes and give you some tips to prevent it. So stay tuned. If you've had your procedure within the last 6 months, you might have already experienced moderate to extreme hair loss. But don't worry, okay, with the right diet and nutrients, it's something you can manage. Wendy from Kenosha submitted an email question, and she says, I remember my doctor briefly mentioning hair loss, but I didn't imagine it was going to be like this. It's been happening for 2 weeks now, and I'm very concerned. What can I do? Well, first, Wendy, I want to let you know that hair loss is a very common occurrence with bariatric patients. It's more common in women, but it also does affect men. The good news is it's more than likely not permanent. Okay, around 99% of patients will eventually grow most of their hair back within 18 to 24 months. Now, it might make you feel like not going out. It might sound like it's the end of your social life, at least for several months. Most people are not going to be too happy about losing half of their hair for almost 2 years. So let's take a look at some of the potential causes, and then we'll look at what can be done to help prevent or at least minimize the loss and get your hair to grow back even thicker and stronger than it was before. Sound good? Great. So our hair is in a constant cycle between anagen, catagen, and telogen stages. That means it's either growing, becoming dormant, or being pushed out by new hair, and that's when it falls out. Now, normally, we shed around 50 to 100 hairs a day, and at any given time, around 90% of our hair is in some form of transition. Now, doctors don't fully understand what causes post-surgery hair loss, okay? But stress, nutrition, and genetics all play a factor, okay? Basically, our bodies undergo a lot of stress during and after surgery. You add to that by literally shocking your body into a totally different nutrient state, all right? And factor in emotional eating that comes to a complete halt because you physically can't eat the way you used to. You're basically set up to cause hair loss because as your body goes under all those different stresses, it starts to channel away nutrients from your hair because as far as your body's concerned, hair is purely cosmetic. Okay, it keeps your head warm, sure, but it's not that important for sustaining life. So your body channels nutrients away from your hair and directs it towards vital organs. Okay, that process is called TELOGEN effluvium, and it causes excessive shedding. Basically, all the hair you had that was in a state of dormancy at the time of your surgery pretty much skips straight to the telogen stage and just falls out. Hair starts in the anagen phase, and it can stay there for from several months to even years. It then moves to the catagen phase and becomes thinner and slides up. Then in the telogen phase, a new hair comes in and pushes the old hair out. With telogen effluvium, the hair falls out before a new dermis is ready. Okay, that again, pretty much skipping the catagen phase. Now, the telogen phase normally lasts about 3 to 4 months, and that's why you don't see a lot of hair loss right after surgery. You can see it typically starting a couple of months later. And you might start to notice, in the shower, a big pile of hair in the drain, or you'll brush your hair and notice you pull out a huge ball of hair in your hairbrush. That can really make people freak out, okay? And that just adds more stress. That process, like I said, usually starts around 3 months after surgery, and it's going to peak around 6 to 12 months. And then somewhere around 18 to 24 months, you'll probably have 90% of your hair back. If you don't take the right supplements, it might not be as thick as it used to be, okay? But it will grow back. Now, once you reach that telogen phase, you're not going to regrow your hair until it falls out and your body starts to get the nutrients to enable it to switch back to the anagen phase. So let's look at some of the causes and then look at what we can do before surgery to prepare your body and minimize that initial loss, and then what we can do after surgery to quickly transition back to the anagen phase. And as you'll see, even get thicker, stronger hair than what you had before surgery. Okay, people are all different, right? Genetics plays a huge role. Basically, if your parents had hair loss, you probably will too. Surgery, trauma, chronic illness, acute weight loss, all these things can cause hair loss, and you are literally going through every one of those things with your bariatric procedure. Okay, so keep that in mind. Now, the type of procedure that you go through is also going to determine how severe your hair loss can be, okay? So there are so many factors here that come into play, and that's why people, maybe some people lose a handful of hair a day, and others feel like they need to start wearing a wig or a hat every time they go out. For example, gastric bypass patients are going to be hit the hardest with hair loss. Sleeve patients are going to be maybe in the moderate to severe category. Gastric banding patients, they're going to be looking at minimal effects, okay? But they also have to deal with much slower weight loss. Now, iron and zinc deficiencies can play a huge role here, but also you want to be careful with that because too much zinc can actually inhibit the absorption of iron. Too much vitamin A, incidentally, can also cause hair loss. Now, I don't recommend iron supplements unless your doctor says that you're iron deficient, okay? And let me mention along with that, don't take prenatals unless you're pregnant or have been prescribed them by your doctor. Prenatal vitamins do have a lot of iron, and people sometimes think, I'll just dose up on prenatals. But if you're not actually pregnant, too much iron is probably going to damage your liver. And what we can do to give our hair the nutrients it needs to maintain healthy growth and minimize the loss is to start supplementing not only the iron and zinc, but also biotin. Biotin is an essential B vitamin, and you're going to want 4 to 10 milligrams per day before your procedure and for a year or more after. So you've got iron, zinc, and biotin, but some of the most effective supplements for hair loss also have a special key ingredient that's been used for thousands of years. And because of its anti-inflammatory effects and antioxidants, it's extremely potent. It's called horsetail extract. And before you freak out, it has nothing to do with cutting off a pony's tail, okay? It's actually an herb. Horsetail has been used to treat all sorts of ailments. It was eaten by the Romans regularly, and even today you can find it on menus in Japan. It's all natural. It's a super good food for you. Throughout history, like I said, it's been used by ancient healers to treat so many things. But more importantly for us today is its powerful properties when it comes to hair loss. Personally, I try to use natural treatments whenever possible, okay? That's just me. But I love when science supports these herbal remedies. So let's take a look at how science supports this. Horsetail extract strengthens your hair because of its principal ingredient, silica or silicone. And it helps not only your hair, but your fingernails and bones as well. And it doesn't just make your hair stronger. It improves its sheen and its texture. Now, another super powerful mineral in horsetail extract is selenium. That's going to help your body process iodine. And guess what iodine does for you? It regulates hair growth. If you're not getting enough selenium, your hair will stop growing. Do you want to prevent hair loss? Do you want super strong, healthy hair? Do you want to regrow hair you've already lost? Iron, zinc, biotin, and horsetail are all proven nutrients that'll do that for you. A recent study showed an average increase of hair growth of 35.7% with these supplements. Another study conducted by the Journal of Clinical and Aesthetic Dermatology featured women aged 21 to 75 with temporary hair thinning, like what happens after a bariatric procedure. This was a double-blind, placebo-controlled study. It revealed significant hair growth was achieved by taking these supplements. You might think that results like this are going to be really expensive, but I've got some great news for you. It's not, okay? At bariatricfooddirect.com, we carry a rejuvenating supplement from Bariatric Fusion. It has, get this, 15 milligrams of zinc, just the right amount, 4,000 milligrams of biotin, and 10 milligrams of horsetail extract. And it's the best kind, whole plant. All of that in one bottle, not $75 like you might think, not $50, even though you'll find it online for that much, but for only $19.99 per bottle. There are 60 capsules in a bottle. If you take one a day, that's a 2-month supply. That's a fantastic deal already, okay? But I'm gonna make it even better for you right now. For those of you watching this video, if you order today, use coupon code HAIR-TODAY and you'll save an additional 15% off your first bottle. That's today only and only while supplies last. Thanks so much for that question, Wendy. And listen, whether you're getting ready for your procedure or you've already started seeing your hair fall out by the handfuls, grab a bottle right now. Get those essential ingredients for healthy hair regrowth. Get it while you can. If we're out of stock, check back because we typically get shipments every day. Click the button below and that coupon code will be applied automatically. Remember though, the discount only shows up on the checkout page. Thanks for watching. We'll see you next time.